The most common procedures that involves a plastic surgery after bariatric surgery, it's the procedure that involves the chest and the tummy. On the chest, we have the mastopexy, also called as a breast lifting, breast implants, or mastopexy with implants. On the tummy, we have liposuction, tummy tuck, and other devices that involves in this part like Vaser, the J-plasma, and also BodyTite. The tummy tuck procedure usually involves the correction of three main problems: the extra fat, the extra skin, and the muscle diastase. We remove all the skin from belly button until the cesarean line. We do a liposuction that takes the front, the lateral, and also the back. And especially, we do the correction of the muscle diastase. We connect the muscles because they are open during the pregnancy or even when the patient are overweight. So after the bariatric surgery, usually we have this muscle diastase that when you connect it, we can call it also as an internal corset. We create shape and definition by removing the skin, connect the muscles, and the liposuction. After a bariatric procedure, we should consider a plastic surgery when the patient gets a stable weight. Usually this is 1.5 years after the bariatric procedure. And that means that we need to get even also 6 months of stable weight. Because after the bariatric procedure, usually the patient has some oscillation, and you should not perform any kind of procedure when the patient are gaining weight or losing weight. So to get a stable weight, it's extremely important for a good result for the plastic surgery. We should consider a plastic surgery for those patients who feel uncomfortable in front of the mirror, who doesn't feel confident, because after a weight loss procedure like a bariatric surgery, usually the patient has too much skin, so the patients they feel ashamed about their bodies. So the plastic surgery will return the self-esteem back for these patients. Once that we remove this skin and get a new shape, they feel more confident and better with themselves. We work closely with the bariatric department here in Danat Emarat because it's extremely important to work as a team. A plastic surgery is not the initial process, it usually comes in the end. The first stage for the patient when they are obese or extremely obese is to go and proceed for a bariatric procedure to lose weight, and after that we correct the extra skin or muscle diastase or any other problem that the patient has. So it's always a combination. So we work together for the safety of the patient.
Worldwide, the commonest performed bariatric surgical procedure is considered to be a laparoscopic sleeve gastrectomy, which is a surgical intervention in which around 70% of the stomach is removed. This is followed by laparoscopic Roux-en-Y gastric bypass, and then followed by the one anastomosis gastric bypass, also known as the mini gastric bypass. There are various factors that we take into consideration when we predict the amount of weight a patient will lose after their bariatric surgery. For example, their sex, their age, and their parity. The more a woman had given birth to, the less weight we anticipate that she'd lose. On average, following a laparoscopic sleeve gastrectomy, we anticipate that the patient will lose around 65 to 70% of their excess weight at 2 to 3 years, and following a laparoscopic Roux-en-Y gastric bypass, we anticipate that the patient will lose between 70 to 75% of their excess weight at 2 to 3 years. At Danat Emarat, it's very common for us to come across women who attend our bariatric surgical services aiming to lose weight. A lot of these women had suffered and struggled with obesity for several years and had had several pregnancies over the years. After their surgery, we anticipate that they would lose a considerable amount of weight, and as a consequence to that, they'll have a lot of excess skin. Because of this, they will probably going to end up needing to have some sort of a cosmetic procedure like an abdominoplasty or a tummy tuck or a tummy lift to help them get rid of the excess skin to achieve the desired shape that they aspire to achieve at the beginning of their surgeries.